GLP market seems to be exploding. What's new?
As everybody else's waistline keeps imploding, find out today on Medical History Mysteries.
I hear GLP, I don't know, a million times a day. So whether it's on social media, people discussing it, conversations with patients, it seems like it's everywhere. Tell us about it.
So there's so much information about GLP-1s, even I get overwhelmed sometimes. And it's funny because when you and I have our private conversations sometimes and you ask me questions, I actually have to go look it up because it's changing sometimes overnight. And that's disturbing to me because this is my job. This is what I do, right? So I stay on top of almost everything, and even I can't keep up with all the changes. So imagining dental professionals trying to keep up with all of this like flood of information and still being able to counsel their patients and talk to their patients is I can imagine overwhelming. Um, so what's new lately? Well, number one is a new drug. It's called Foundayo. It's made by Lilly. And the interesting thing about Foundayo is even though it's a GLP-1 agonist, they did not seek approval for treatment of type 2 diabetes. They went specifically for weight loss. So that kind of tells you the direction the market's taking. You know, it's great that these drugs can treat type 2 diabetes, but this veering off, if you will, I guess because Lilly can afford to since they've got other drugs on the market. This sort of veering off the mark onto just let's just head for weight loss obviously tells you what the bigger market is. Yes, treating type 2 diabetes is great, but weight loss seems to be the big driver here.
Well, it almost sounds like they're indirectly treating type 2 diabetes if being overweight or obese is a significant risk factor for diabetes. But people seem to be taking matters into their own hands, right? You can get this via a prescription, or you now can just kind of get it on your own. What's up with that?
So that's a big problem too, man, because that just encourages polypharmacy. And I'm not trying to criticize anybody here, so no one get the wrong idea. But you can buy these drugs from a pharmacy, certainly, but you can get them yourself, number one, directly from the manufacturer. They have direct to consumer um, programs where you can basically ship it directly to your house. And you can get it from other companies online. I don't have to mention the names. I know you know who they are that sell GLP-1, sometimes compounded by compounding pharmacies, which has been a big problem because compounded drugs are not FDA approved by definition. So you're buying it from a pharmacy that's making it, but it may not have the same efficacy or may not follow the same practices that a manufacturer would follow in making it. But the polypharmacy thing is important because maybe people don't necessarily want to mention it on their medical history. And if, it's not a drug that I think I take that you need to know about, well, then I'm not going to mention it. Or maybe it's because I don't want to mention it, but that's important about how we talk to our patients and how we have conversations. So that's why I've always said for 1,000 times, I know you've heard me say it 1,000 times, I never ask a patient what medication do they take or what drug do they take. Because that interpretation of that word can be so wide open. I just say, what do you take? And that way, and I keep asking the same question in different ways over and over so that they give me everything. Because again, if I'm on, a drug like a GLP-1 that I bought from an online pharmacy, I may not take to tell you that because I didn't get it from my pharmacy. So therefore, it's not a medication. It's just something I take to lose weight.
Well, this is interesting because I know we ask every time as dental professionals, what are you taking? Did you take it today? How often do you take it?
Yeah.
And that's important to know. But I think that when people are taking matters into their own hands, they don't realize that they're putting themselves at risks for the side effects of these medications, number one. And number two, the side effects seem to be a problem, now not a problem. The information's all over the place. Like, for example, thyroid tumors. What's the latest on that?
Right. So it's a good point because, I know some of these programs involve medical doctors. And again, I don't want to step on their toes. If they've got a medical consult on the phone with a medical doctor, I would never want to supersede their decision if that patient's right for a GLP-1 or not. But there are side effects, and in my opinion, with GLP-1s, we're squeezing what would have amounted to be 20 years of experience with these medications into like 3 years. So that's why you're seeing the information shift subtly, shift violently, because oh, no, it causes thyroid tumors. No, it doesn't. Yes, it does. Or it causes hair loss. No, no, it doesn't. Yes, it does. Or, suicidal ideation was one that was there and then it's not. So it changes so rapidly that that's why when I was talking about in the first part of our conversation that it gets confusing. So what is it about thyroid tumors right now? So the thing is, all of the GLP-1s carry that warning that says, that they can cause thyroid, medullary thyroid cancer. Okay. But it's a relatively rare form of thyroid cancer. So it's not like you're going to see it very often. And the overwhelming information is they don't necessarily cause an overall increase in the risk for common thyroid cancers or common thyroid disorders. But if you're an average patient, do you know what medullary thyroid carcinoma is? Do you know what the symptoms are? Sometimes it's going to be a dental professional, your hygienist, your dentist, who's going to be, palpating and notice that perhaps your thyroid doesn't have the right feel to it, or you kind of feel the things you would normally expect to feel if there was an issue with their thyroid gland, and maybe the patient's not ready to accept that because they don't think this medication causes a problem with their thyroid. It's just for them to lose weight. Now, the other problem is some people lump together a GLP-1 and some non-traditional ways of losing weight, like low dose levothyroxine. Again, there's no evidence to suggest that that causes an increase in thyroid disease or cancer, but heck, I don't want to take that risk. And so that's why I think it's important for us to really stay on top. As I say all my audiences, stay frosty. You gotta read every day because every day this can change.
Wow. So I think that as dental professionals, we need to certainly ask our patients the question. Obviously, never lose sight of our head and neck exam, and obviously, it's possible to link one thing to another. Not that that's our job to do it, but at least we know enough to always look and stay frosty. I love that.
Yeah.
And finally, patients might also be taking medications to counteract the side effects, like, for example, hair loss. So we should always be looking for the side effects that can come from that medication as well.
Yeah, hair loss is a big thing with the GLP-1s. And I should know, right? I'm follicularly challenged myself, so I should know. But this is a problem for some folks who take a GLP-1 because they want to lose weight and they want to look good. And I don't blame them. Everyone wants to look their best. But when they start losing hair, it's almost in their mind counterintuitive. Like, yeah, I lost all this weight, but my hair's falling out. Now it does tend to reverse itself when you sort of stabilize when you're at your goal weight. But in the meantime, a lot of people go to drugs like minoxidil, which you can get, and I don't have to say the names of the pharmacies online. You can go buy them, and so, okay, now you're taking a GLP-1 that's causing hair loss, but you're using minoxidil to restore the hair that you lost. But minoxidil topical, and even some people take oral minoxidil for this reason, it causes severe hypotension. If you already have hypertension and you're taking another drug for hypertension and then use minoxidil to grow your hair back, do you know that that's also a drug that could lower your blood pressure like your other medication you're taking? So now you get severe orthostatic hypotension. You can pass out behind the wheel. You can faint on the street. I mean, those may be a little hyperbolic, but you get the point. So it's, again, that's polypharmacy. Again, that's where it's a good thing. Lose weight, everybody's happy. If as long as you like the results, that's great. But again, that sometimes it's us. Sometimes we're the third eye in a way. That the dental professional sees everything with that fresh set of eyes and says, "Wait a minute, you're doing all this. Realize this could be a problem for you. This can cause a health problem. You really should speak to your doctor." And I know everybody who hears me say that says, these people don't listen to me when I tell them to brush and floss. Well, what makes you think they're going to listen to me when I tell them don't take minoxidil? But the fact is that you do say it and it does register with them because in their mind, it's like, why would you say that? Obviously, if you're thinking it's a problem and you're a dental professional, maybe it is a problem. So look at it from that
Absolutely.
perspective. Yeah,
Well, I think all we can do is encourage the conversation, increase awareness, and help them get the care that they need, or at least the monitoring that should come with these
great,
medications, whether it's self-prescribed or otherwise.
great.
So, well, I think this was a great overview of what's going on right now in the GLP world. I think we will be staying on top of this as this topic and conversations and side effects evolve. So, thanks for that.
Sounds good. Thank you so much for bringing it up. This was a great one. Thanks.
All right. Well, everybody, thanks for joining us for Medical History Mysteries, and we can't wait to see you all next week.
See
See
y'all
ya.
soon. See ya.